Hey, so it has been a insanely bad flu season. This is the sickest my patients have been this last week, the whole year. It's currently February 19th, 2026. And with this video, I just wanted to talk about a few things. One is just, why is this flu season so bad? The second thing is, what can you do about the flu especially if you catch it early? What can you do to not get sick, including how well the flu shots are working, and when you should see your doctor during having the flu or after the flu. So first, why is the flu so bad this year? Well, we have a strain, an H3N2 strain, which is flu A, and it is more contagious than the regular flu that usually goes around. It's not more severe, but it's more contagious. So this year, way more people are getting sick. It's spreading easier, but it is not more dangerous. So, and second, what can you do if you get the flu? Well, one of the most important things in pediatrics, especially if you catch the flu within the first 2 days, you can get treatment by either Tamiflu or Xofluza, which can shorten the duration of the illness. Sometimes it could make the illness 2 days less, sometimes maybe only half a day less. So Tamiflu is a liquid or a capsule, and it's approved down to kids of 2 weeks of age, and the younger the kid, the better it works, which is pretty cool. So with Tamiflu, if a kid has the flu, they would take it twice a day for 5 days, and it's only prescription. And a lot of people know that sometimes Tamiflu can cause GI upset, some nausea, sometimes some vomiting, but not all the time. And it's hard to tell if it's the flu that's causing that or if it's the Tamiflu. Now we have Xofluza, which is newer, a whole different kind of medicine. And you know what's awesome about it? It's just one dose. That's right, just one pill. You take one pill within 48 hours and you'll have less sickness, less complications, and that's really great. So those are your two choices, Xofluza or Tamiflu. Both are prescription. A lot of times your doctor probably won't want you to come into the office if you call and let them know, hey, my son or my child tested positive for the flu. They just started getting sick yesterday. Can I get Tamiflu or Xofluza? And I think they would gladly just send it to the pharmacy instead of have you come into the office. So then what else can you do? If you're past that, it's just the regular things, try to get fluids, take ibuprofen or Tylenol for any body aches. You can use dextromethorphan, which is Indelsin or Robitussin DM for coughing. And then I really like the Sudafed that's behind the counter if the child's old enough, like older kids and teenagers, it works better. The Sudafed PE in the aisle, in my opinion, does not work very well. And I try not to use Afrin for anyone because it does work and maybe it's safe for 3 days, but I've seen many people kind of get dependent on it, and whenever they try to stop, their runny nose comes worse. So really, with the flu, regular treatments. And then when you have the flu, and you've had the flu and you've kind of gotten better, but you're not getting better, when do you see the doctor? Well, anytime you're concerned about yourself, you should contact the doctor. With us, you can just drop us a text. With other offices, maybe send a message through a portal. But definitely if you've had a runny nose for 10 to 14 days, it might have become a sinus infection. Anytime you seem to have gotten generally better and then get worse, whether it's new fever, new coughing, any new chest tightness, definitely, or if you're having, of course, weakness in your legs or trouble seeing or severe headaches. So really, if things are just getting stuck, after about a week to 10 days, or if you're getting worse or having new symptoms, definitely see your primary care provider, go to an urgent care, or even an ER. So what choices do you have, or what things do you have in your toolbox that can keep you from getting the flu? Obviously, washing your hands. If you have kids, have them learn to cough in their arms. But say you're a parent, or you have a child and the other child gets the flu. You can either take Xofluza or Tamiflu prophylactically, which is pretty cool. They're even, I think, better at preventing people from getting the flu than they are of treating the flu. So say your kid, that happened at my house, one teenager has the flu, we've all been around him, we just thought he had a coughing congestion, and we all just get once daily Tamiflu for 7 to 10 days, or just a Xofluza dose works pretty well too. But then, you know, what is the best way to be prepared for the flu is always, and has been, a flu shot. Flu shots have always been so safe, and they're effective, you know, depends on the year, how well scientists predicted that flu strain. And this year, even with this kind of new strain that's stronger than normal, the flu shots are still helping people. They're keeping people from getting hospitalized, keeping people at work, helping people get back to work, preventing sinus infections, less antibiotics, less pneumonia. So definitely, if you're someone like me and you really like to try as much as you can to avoid antibiotics, one of the best things you can do is get the flu shot, because you'll have less chance of complications. So otherwise, to prevent the flu, of course, eating well, exercising, and sleeping well, which is hard to do in our stressful world. So I hope these things were helpful. I hope your family avoided the worst of it, and I'll see you around.